All right, welcome back. Good morning. It's still morning here in Minneapolis, Minnesota. My name is Lindsay Brown from the Beyond Clean team. Thank you so much to all of you who are tuned in to the industry's first conference focused exclusively on dental reprocessing. Peggy Spitzer is becoming a regular at Beyond Clean events, and we are so happy about it because of her engaging presentation delivery and her vast knowledge of instrument cleaning chemistries. She has over 30 years of combined experience as a healthcare provider and educator. She's a licensed dental hygienist, and she was a full-time college faculty for over 20 years and managed several large clinics. This presentation that Peggy is going to give today will cover the use of references and a checklist to audit department chemicals and clinic chemicals. Program resources will help with training, with staff competencies, with compliance, leading to increased safety for both technicians and patients. So it is my honor to welcome once again Peggy Spitzer.
Hi, and thanks for having us here again at Beyond Clean. So I'd like to always do a shout out to Beyond Clean for offering such great CE opportunities to everybody here. And as was mentioned, I am Peggy Spitzer. I'm a dental hygienist. Previously, yes, a full-time faculty, taught for over 20 years, torturing students and hopefully giving them a good career. So I was also a clinical coordinator. And my disclaimer is that I am now a full-time employee here at Sterile International. Sterile is a manufacturer of disinfectants and detergents. And so part of the reason why I like to offer help for those of you out there in the trenches is because I was there and I understand a lot of the dilemmas and things that you face. And now I have the opportunity to have more expertise and understanding of the background about chemicals. So this program is, however, non-commercial. It's very objective. We won't be focusing on brands, particular brands of any chemicals, but my program, I should say, is based on the many hundreds, even thousands of calls I've received over the years from active clinicians in both medical and dental with many questions about the chemicals that they're using. So our focus today is going to be very basic. We have somewhat limited time, so we're going to focus on just a few areas. And with that introduction and that disclaimer, we're going to move on to our next slide here, and we're going to look at the learning goals for today. As I said, mentioning earlier, we're focusing primarily on detergents and disinfectants, trying to give you some tools and resources for that. This is certainly a platform for helping you figure out chemicals in your office. It is, however, not a complete HAZCOM training program. So for those of you out there that are looking for HAZCOM training, you will understand later in the program why it's not a complete HAZCOM training, but it is intended to give you some ideas for training and auditing in your office. So we are, again, going to focus on basically two chemical areas, detergents and disinfectants, and especially to try to help you address some common misunderstandings and common misuse that occurs out there with the best intentions. And I will say, again, having been in your shoes, I totally understand these misunderstandings and misuse. Everybody's trying to do the best they can, but we work in a very complex environment where chemicals become just sort of background. And I think it becomes very difficult to have best practices when you have such a difficult and busy environment. So we are going to move on now and get on to the next. And that is, what is your chemical nightmare? In every practice, there's things that happen to patients, things that happen to your coworkers. One story I remember hearing from a manager at a school, a big university dental clinic, involved a very tiny chemical, and that was acid etch. The acid etch was accidentally dripped on the patient. And here's a tiny material that you don't use very much and you wouldn't think is particularly risky. And that became a big issue for that facility with that patient with that acid etch. So you just don't know where some of these problems can come from with the chemicals that we use. And we just have to be mindful. So we're going to be looking at both best practices and worker safety to focus today. Now, we're going to be looking at some poll questions that will hopefully give you a little interaction in the program. So I'd like you to look at them fairly quickly. Which of the following is the most dangerous? This is an opinion. There may be more than one best answer. So what do you think? Think quickly. Household bleach, detergent concentrate, glutaraldehyde, or rust remover? Which of the following is the most dangerous? Submit your answer quickly, and then we're going to take a look at the poll results here in just a few seconds. Glutaraldehyde, great choice for those of you who picked that. I will tell you that any of those chemicals have potential. Certainly, any of them can be dangerous. We just talked about acid etch, a tiny amount of chemical that could also be very dangerous depending on where it lands. So glutaraldehyde, oftentimes referred to as cold sterile or high-level disinfectant, certainly has a very high potential. You have another speaker that's going to get into that in a lot more detail, but we're also going to understand a little bit about why any of these chemicals can have dangerous components in their daily or frequent use. So when you look at, and this is not a comprehensive list, this is simply a list of the basic chemicals that are found in most dental practices. And I will tell you that one of the ones on here that I personally find the most exciting is compressed gases. Compressed gases can have both a physical danger as well as an actual chemical danger. And gases in general are sneaky. The way that they can be absorbed without really much understanding of what you're being exposed to, and especially if there's no odor. So any of these categories of chemicals can present risk. And as we said earlier, we're going to focus mostly on detergent and disinfectant. Even water is a chemical which definitely affects instrument processing, affects many other areas of dental practice. Water is a chemical, perhaps not with the safety issues of other chemicals, but certainly is an issue in your office. So now we're going to look at chemical safety, and we're going to go on to our next poll question. Again, real quick, just look at it quickly. Mary has splashed disinfectant in her eyes. Why do you think that happened? She's a new employee. She didn't have training yet. She took her safety goggles off to read the directions on the bottle. The container wasn't even labeled with the hazard statements. Which one do you think? Obviously, this is a guess one. Just guess and tell us what you think. So a great choice that everybody thought was the right one. And certainly, again, either of the other choices could also have been an issue. But it's quite likely, and maybe some of you have seen this in your own practice, where chemical exposure occurred because of a lack of training. Perhaps the particular PPE training hadn't been completed, or the person just didn't understand how important it was to keep their goggles on when they're handling chemicals. So this takes us directly to our next slide, which is understanding that chemicals can get into you many ways. You know, we're I think, more aware of chemicals being splashed on our skin. And certainly we're all concerned about our eyes, and we know how critical that can be to have chemicals splashed, exposed to your eyes. But I will tell you again, one of the sneakiest ways to be exposed to chemicals is through your lungs. And that can be in the form of gases, aerosols, mist. So one thing I'd like to mention now, and you'll hear me say it several more times, and that is try to reduce the aerosol exposure in your office practice with chemicals. And probably the number one way to do that is to reduce the amount of spraying of chemical disinfectants in your clinic. Liquid chemical disinfectants are very popular. They're certainly easy to use, but they're not intended to be fogged all over a treatment room. So this could be probably one of the #1 takeaways from this program in your office is meet with your team and figure out how you can reduce aerosols, particularly of chemical disinfectants. That is really a #1 thing I think you could all shoot for. So we're going to see this slide, or at least the components of it, several more times, and that is, what is your toolbox for chemical safety? And of course, this also leads to chemical best practice. And you're going to hear this several more times, kind of tiresome, but the reality is you cannot deal with chemical safety in your office without doing a chemical inventory. You must know what's in your office. You've got to look under the sink. You've got to look in the refrigerator. You've got to probably find some stuff that's maybe hidden in the office practice owner's office. Chemicals are hidden everywhere. So be sure that you look carefully, thoroughly, and make an inventory. In that process, you'll probably find old and outdated materials that need to be discarded. And of course, there's always the issue of discarding chemicals safely. So that #1 thing is doing that chemical inventory. You have to have that before you can do anything else. Then the tedious job of going through and finding the correct and updated safety data sheets for each chemical. Rounding up all your required compliance materials like those posters, doing your labeling, figuring out your first aid and safety. All of that depends on that chemical inventory. You can't do training until you know what you have in your office. So that's got to be the #1 thing. A quick couple of slides here just to tell us a little bit about the agencies that I know you're all familiar with. Of course, OSHA is going to be #1. And I think what I like to remind my dental audience is we're used to focusing on OSHA for bloodborne pathogens. But we need to be aware that the hazard communication standard is also part of OSHA, and it too must be covered annually. This is law. This is not just a guidance or a recommendation, it is the law. And OSHA does require employers to organize and provide this training for both bloodborne and hazard communication standard training. NIOSH is a part of the CDC, provides excellent research, also some great resources, particularly in the area of respiratory and masks. And of course, you're all familiar with the CDC as an excellent resource. We don't typically think of the CDC as much when it comes to chemicals, but I will tell you that there is good guidance, particularly in the newer edition of the CDC Guidelines for Dental Practice 2016. So I urge you, if you have not paid much attention to it, to use both the 2003 and the 2016 CDC guidance for your office for chemicals. The CDC 2016 has a great checklist in it that can be used to help you with some of that work. Also, be aware that many state boards across the country are now citing the CDC guidelines in the state practice law. That's where it becomes the law, is when it's cited in your state practice act. I know we do have that here in Colorado. Here are a few more agencies that we need to be aware of, especially when it comes to chemicals. The EPA, of course, regulates low and intermediate level surface disinfectants, as well as waste material. Most of you are familiar with the rules that are around now for mercury and amalgam disposal. So that's also part of the EPA. The FDA regulates high-level disinfectants. So when we talk about so-called cold sterile or high-level disinfectants, those are regulated by the FDA. The other real important role of the FDA is in working with medical device manufacturers. Medical device manufacturers have to work with the FDA and follow FDA guidance for creating their instructions for cleaning and use. And so that is something you need to be aware of, that the FDA does regulate that. Some of you are aware of AAMI. AAMI is probably been more important, or probably been more well known and used on the medical side. But I want to share that even certainly for those of you who are in community health centers, you're in hospitals or other settings that may be regulated by the Joint Commission or other third parties, you're certainly more aware of AAMI standards. But I really encourage all dental settings to understand what AAMI is and the resources that are available through AAMI, in particular two technical documents, TIR 67 and TIR 68, also TIR 34, which is for water. Any of these documents can be purchased through the AAMI website, and they give you more background information on how chemicals are regulated and used in medical and dental healthcare settings. Now, many of you have seen the poster. Hopefully you have seen the poster, because the poster is supposed to be made available by your employer. It is also available in Spanish. It is important for everybody to understand that the OSHA standard is not only the right to know your chemicals, but also to understand your chemicals. So it's not just enough to know you have such and such chemical in your office, but to understand how to use it safely. It's really the employer's job to have the chemical inventory and the program and so forth. But you as a worker need to be educated and understand what your rights are so that you can then help your employer to implement all of these different basics. And this is what I basically try to tell everybody in all healthcare settings is, yes, it's the employer's job to set this up, but it's usually the workers that really need to help your employer to understand all the things that are required and to work within your practice environment to gently but firmly move compliance forward, because ultimately it's for your benefit, your safety. You are the worker and you deserve a safe work environment. So here's another poll question. Where are those safety data sheets in your office? So look at that real quick, make a guess. You don't have to, it's an opinion. So take a look at that real quick. Figure out what you think the answer might be, and then we'll go on to that. I think we're still thinking. Where are those safety? Where are the safety data sheets in your office? Okay, so maybe we're just not sure. So in any event, that should tell you something right there. If you're not sure where the safety data sheets are in your office, or you suspect they're somewhere where they can't be really accessed very easily, that's a big issue. Very, very important that safety data sheets be available to every worker. So the great thing, I guess, at least for you, the worker, is that safety data sheets are now standardized. It's been a nightmare for us, for the manufacturers of chemicals, to create and redevelop all of these safety data sheets. We did that for the past 5-6 years, getting all these safety data sheets recreated, updated in this new format. But the great thing now is no matter what brand, no matter what company, you can always find first aid information in Section 4. Every company must comply with these standardized formats for safety data sheets. But you, at your end, at the clinical end, you need to make sure you have the most recent safety data sheet that has this new format. So you also have to make sure that you actually have the correct chemical for a safety data sheet for that chemical. We'll see how to find that here in just a second. So the key thing on this slide is easy access. It can be electronic, it can be print, but it's got to be easy access. It cannot be locked up in the practice owner's office on their computer. It's got to be easy, and people need to know how to read it in an emergency, how to find information quickly. Now, this slide shows us on Section 1. That's where the name of the product will be. This seems kind of silly to make a big deal out of this, but I will tell you that, for example, Clorox or Lysol, very big brands, big companies, certainly nice, reliable chemicals, but Lysol or Clorox can have 10 or 15 different brands of disinfectants under the Clorox or Lysol name. You have to make sure you have the safety data sheet that corresponds to the actual product. So this is more confusing than it might seem. Make sure you have the right safety data sheet matched with the correct chemical and that you have the new one. Now this slide just shows us through section 8. There are an additional 8 sections that can be present on a safety data sheet. There is one more section that we will look at in a little bit more detail, but the first 8 sections are the ones you really want to know about and how to use quickly, especially for safety, PPE, how to do things in the event of a spill or an emergency. So that's why we have highlighted those on this slide. Now we have another poll question, and this one's a little more complicated because it's in 3 parts. I'd like you to look at this pictogram, try to figure out which hazard is represented by this pictogram. Make your best guess, make your guess quickly, and then on the next slide, you're going to pick it. So look at that pictogram, decide which one you think it is, and then the next slide, you're going to select it. So that pictogram that we just saw previously, is it for bleach? Is it for irritant? Is it for corrosive? Or is it an unknown hazard? Think quickly and pick one, and then we'll see what came up here. This is one for where there is one correct answer. Oh, excellent. And that one is a tricky one because those are 2 common hazards that are found in many chemicals in the dental and healthcare settings. So the correct answer is corrosive. It's a corrosive chemical. Let's go back and see if we can bring that slide back up. So I want you to look at that pictogram again. That pictogram is for corrosive. And you can see on there, there's a little surface, so it's a corrosive surface, or it's a corrosive for the skin. Now we'll move on to the actual pictograms. So here we have the pictograms that you should be familiar with. I have many people that tell me, you know, I've seen them, but I'm not really sure what they mean. This is really crucial because the irony of the pictogram is that it was supposed to be a way to quickly tell you what kind of hazard you have in a chemical without using language. So if someone was illiterate or they spoke a different language or couldn't read the English on the label, they could look at the pictogram and know the hazard. But unfortunately, that idea loses its benefit if you don't understand what the pictograms are. So the 2 at the top are the most commonly used, the ones that we see most commonly in our chemicals used in healthcare. And the one on the left with the exclamation point is irritant. So that's an irritant symbol. The one on the right, the one we just saw for the poll question, that's corrosive. And that can be corrosive to surfaces or corrosive to skin. The 2 that are below, I've always been kind of annoyed with how they figured out those 2 because I think they're too confusing. The one that's looks like it's got an O in the middle, the O stands for oxidizers. So oxidizers are common chemicals used in disinfectants. Things like hydrogen peroxide or bleach, those are oxidizers, and they certainly can have chemical hazards. The one on the right that you're probably more familiar with is flammable. And of course, many alcohol-containing disinfectants are flammable if they have a high enough level of alcohol. The other pictograms represent something that could be explosive. You see the compressed gas symbol. You see the highly toxic danger skull and crossbones that most of us are aware of. And then you see one that sometimes is a little confusing. This is a pictogram for health hazards. And the health hazards can be low, warning, or they can be high. They can be danger. It's not just carcinogens. It can be any type of health hazard. So here's another one that I really like to emphasize when we're talking about chemicals in healthcare settings, and that is the difference between acute and chronic exposure. You can have a chemical that's really basically not that dangerous. And a good example might be that acid etch that we talked about before. The acid etch could be a relatively minor, tiny chemical, and yet if it's splashed in a patient's eye because there were no goggles in use, that can become an acute and very dangerous exposure. On the other hand, chronic exposures sometimes we think are not a big deal. Chronic exposure can be very dangerous and it ultimately lead to death. Most of you are aware of people who've died from asbestos exposure, or they died from other types of chemicals they were exposed to over a long period of time, and the actual dose on each day wasn't lethal, but it was cumulative. So both acute and chronic exposure can be extremely dangerous, and no chemical should be taken for granted. All chemicals carry some risk in use. We just know that if you get something on your skin or in your eye and it's acute, it's sudden, you're more aware of it. But I just want to keep reminding everybody of how these sneaky chemical exposures, especially through aerosols, gas, mists, they are definitely accumulative in many cases and can be dangerous. Now, here's a slide that I think merits some explanation because it's, to me personally, very alarming and annoying. Why is PPE so low on the scale here? It's like, wait a minute, isn't PPE super important? Aren't we supposed to wear personal protective equipment? So why is PPE at the bottom? It's not at the bottom because it's not effective. It's at the bottom because it requires the most individual effort. So in the world of hazard prevention and control, the idea is to control hazards by either, number one, eliminating them. That's actually something we're trying to do with mercury and amalgam, is just eliminate mercury and amalgam from our dental practice environments and try to substitute other types of restorative materials. Engineering would be practices like safety scalpels, safety needles, where engineering protects you and you don't have to think about it as much. It's automatic. Administrative controls would be things like limiting worker exposure by shift controls, being only in a room a certain period of time, those types of administrative things where there are rules and regulations to control safety. The PPE one, I think the current situation that we have with the pandemic, it perfectly illustrates the issue with PPE. PPE is so effective. We've been told, we know now how important masks are to controlling the pandemic, and yet how hard it is to get people to wear them at all or wear them correctly. So you can now understand why PPE is at the bottom of this triangle. And I like to use this slide as an illustration of what I really see, I see a lot in dental practice, is the creative use of PPE. So what I'd like to point out to everybody is that the top picture of the young lady wearing the scrub top with a long sleeve t-shirt underneath, what that person has created is a two-piece covering that is their PPE that now must be removed before they leave the office, the entire thing, including the long sleeve t-shirt, because that entire two-piece thing is their PPE. So I think we just have to be sensible when we think about what constitutes PPE. And then the other point I like to make, especially for chemicals, is that PPE should be chemical and task specific. I think where we get into this is the argument about whether or not we have to use utility gloves when we're using chemicals to disinfect a dental treatment area. Many office folks like to use their nitrile or latex exam gloves to apply chemicals to the treatment area when they're disinfecting. And unfortunately, that's not appropriate because the gloves may be great for biohazard control for PPE, but they're not appropriate for chemical control. So you're the one that's getting exposed very frequently to chemicals in your setting. And if you have trouble with skin problems, etc., Have you thought about, are you using PPE correctly and protecting yourself from these frequent chemical exposures? The other thing I'd like to mention is, although most people now switch from latex to nitrile, the other advantage of that is that latex gloves can be affected by enzymatic detergent. Latex is protein, enzyme attacks protein. So have nitrile for your utility gloves when you are cleaning instruments with enzymatic detergent. And then all these PPE items do have ASTM ratings. Most of us are familiar with ASTM. That's the organization that tests and rates masks and other materials for their resistance to certain hazards. So be sure you're aware of those ASTM ratings and how they work for the different types of PPE that you have. Okay, so I'm going to mention this just briefly, and you can certainly contact me if you need more information. Eye wash stations are certainly important. I think in dental practices, oftentimes we've seen eye wash stations installed on sinks that are also used for hand washing, and especially sinks that are used for cleaning instruments. Do not do this. Eye wash stations should be independent from any plumbing that is being used for cleaning instruments. They need to be in a separate area, preferably a freestanding type of unit as is illustrated here. But the other important thing is they've got to be checked. They've got to be checked that they're functioning. They need to be flushed so that they're producing clean water, because it's in an emergency, that's not the time to find out if the water is clean. It's also important to make sure that the water is not too hot that's coming through there, and all of this has to be documented. So important. Okay, now we're going to look at another poll question, and again, just make your best guess. Quickly, which type of chemical is safest to handle without gloves? This is obviously an opinion one. Which type of chemical is safest to handle without gloves? Take a quick look. Oh, terrific. Which type of chemical is safest to handle without gloves? Well, of course, this was a trick question totally. No chemical should be handled, at least not of these three, without gloves. Disinfectant wipes are definitely the chemical that's handled most often without gloves. And I will tell you that your PPE is protecting you from both biological and chemical hazards. And that's really the primary reason in healthcare settings why we must have our gloves on while we're handling any of these products, detergents, bleach, and especially disinfectant wipes. Have your PPE on because it's protecting you from both the chemicals and the biological hazards. Now we're going to take a look at another section of this program, and we're going to focus in a little bit on disinfectants. And to do that, we're going to see a very short video. It's about a minute. And I just want to give you a little prelim on this. This video was produced by our company to help introduce industrial and commercial customers to the world of disinfectants. So these folks obviously don't have much training on using disinfectants. So we produced this rather simplistic video, which I cut out some of the commercial part of it. But I think it does present some important information that we should be aware of for all brands of disinfectant chemicals.
Disinfectant labels can be hard to read. There is a lot of information. What do you need to know? First, look for EPA registration. This tells you the product is approved and the kill claims are backed by lab testing. Next,
we're going to try that again.
disinfectant labels can be hard to read. There is a lot of information. What do you need to know? First, look for EPA registration. This tells you the product is approved and the kill claims are backed by lab testing. Next, check your product expiration. When it comes to disinfectants, do not use expired product. Check the label. Is this product ready to use or concentrate? If concentrated, find directions on how to dilute. Concentrated disinfectants must be diluted correctly to kill germs. Wear gloves and eyewear while handling concentrate.
Okay, so I hope that gave you a little bit of information and a little reminder, especially when you're handling concentrated chemicals. That's really the point I want to make, actually, is any concentrated chemical, whether it's detergent, disinfectant, any type of concentrated chemical, really be aware of the exposure that you may have, especially to your eyes. That'll be the one time that a chemical will splash in your face is when you have taken your goggles or glasses off. It just happens. So really be aware of handling chemicals with the correct PPE, and especially if they're concentrated. Now, I'd like to take a look with you at this magical thinking that occurs with disinfectants. It's pretty hard for us to not feel a little bit of magical about disinfectants. And in particular, and then again, this is something that we are all exposed to constantly through marketing, and that's the issue of brand names versus active agents. I have many, many people that will tell me, oh, well, I use Lysol, or oh, I use Cavi wipes, or oh, I use whatever the brand is, but they don't know what the actual chemicals are. And we're going to see here in a couple more slides why it's so important for you to know not just the brand name, but the actual agents that are in your chemical. I know that many of you use liquids and wipes. And what I'll tell you I've heard is that sometimes people feel that they need to use both. Check with your manufacturer, but typically you should use one or the other. Do not use both. Don't use the liquid to do the first round and then take a wipe of the same brand and reapply it, because then you're going to have overuse. But probably more serious is that sometimes we mix and match chemicals. We have two different brands. We have a liquid of one brand and we have the wipes of another brand. I think this is happening more right now because of our supply chain issues that are occurring during this pandemic. And people are desperate. They're trying to get whatever they can get their hands on. Be very, very careful. Do not combine different types of chemicals on the same surface. We already talked about aerosols, and certainly this over-application issue can really cause a problem. I'm going to offer you a really simple idea that you can use really with any brand of chemical disinfectant, something I'd like you to consider for your office. At the end of the day, every day, or at least once or twice a week, everybody in the office fans out, picks one room, and takes wet paper towels and cleans off the chairs, the electronic equipment, anything that they've been disinfecting frequently during the day. This removes chemicals that build up during the day and gives you a fresh start for the next day. So be thinking about how you are applying chemicals to your equipment, and do you ever wipe them off? That can definitely be an issue. The other thing that happens is that we confuse cleaning and killing. Many disinfectants are excellent killers. They're tested by the EPA. They have their EPA registration. They're great killers. They kill, but they may not clean. Products in particular that are over 20 to 30% alcohol, as the alcohol increases, the cleaning power decreases. Alcohol is a fixative. That is, it denatures proteins. That's how it kills, but it may not clean very well. So try again to be aware of the chemicals that are in your product, and understand that the EPA does not test disinfectants for cleaning power. They only test for killing power. So you have to kind of work with the manufacturer and double check whether or not the product actually has cleaning power. The other thing I'd like to mention is the term cold sterilization. I know cold sterilization has been around for a long time. I know we've got a speaker coming up that will spend much more time on it. I hope that you all understand that cold sterilization is an old term that we should not use anymore. Cold sterilants are basically liquids. They're high-level disinfectants. So try to get that cold sterilization term out of your brain. So let's be smart with disinfectants. I like to use the acronym SMART. Know what your surfaces you're going to disinfect and focus on clinical contact surfaces. I used to tell my students the chair does not go in the patient's mouth. You have to disinfect it, but don't get crazy with it. Focus on clinical contact surfaces. Material compatibility is extremely important. Know the chemicals that you're using and are they compatible. Know your active agents. That's what's going to help with the compatibility. Always look for registration, look for that EPA number on your label, and look for TB kill contact time. It's the TB kill contact time that you need to follow. That's the benchmark that the CDC uses in giving you advice about using products. It must have TB kill, and you need to follow that contact time. In general, I think the other thing that people don't understand is as we increase chemicals, we decrease contact time. And in other words, in order to get faster products, because we're always in a hurry, we may not understand that the chemicals are going up. So as we increase those chemicals, we are going to increase our risk of issues like corrosion or residues or other sorts of things. That just happens because we're increasing chemicals to make the product faster. Very important for you to understand. We've already mentioned a few of these things in the supply chain that we're dealing with now. Be very, very careful when you're switching from one chemical brand to another brand. So you can't get your usual brand and you're trying something in the meantime. Be sure you clean off your equipment thoroughly. Clean off with a drop of detergent in a quart bottle of water and clean off the old chemicals before you switch to new chemicals. These chemicals can interact. Be careful if you are in a position where you feel like you have to use household or grocery store disinfectants. No matter what you use in a healthcare setting, it has to be EPA registered and have TB kill. If it doesn't have EPA registration and TB kill, you should not be using it. Bleach, especially if it's household bleach, you must be very, very careful to follow CDC guidelines for how you dilute the bleach. It needs to be diluted on a daily basis. It's highly unstable, so be aware of that. You can't mix bleach up and then use it for a month. Homemade wipes should be discouraged. When I say homemade wipes, I'm talking about chemicals that are poured into a little container of 2x2 or 4x4 gauze. This is kind of an old idea that many of us still do. And you need to understand that chemicals can interact with these gauze materials. And there's so many different types that it's impossible to know which chemicals will interact with which types of gauze. Don't do it. Have your container of gauze, saturate the gauze with the chemical as you use them. Do not pre-saturate. Now we're going to look a little bit at detergents. This slide, I could spend an entire hour just on the slide, but I won't. I will tell you very quickly that chemicals are only one part of the cleaning process. There are many other factors. Water is a huge factor. If you have really hard water in your area, it will affect your cleaning process, and it may require you to increase the dosing of your cleaning chemicals to deal with the hard water. And of course, there's human factors and many other issues. So chemicals are only one part of cleaning. So this slide's just a real quick representation of how detergents clean. They're basically helping to reduce surface tension, kind of separating out the hydrophobic and hydrophilic portions of soils. But basically, detergents do need mechanical action to produce cleaning. And this is why in the dental setting, having a functioning ultrasonic is so important, because otherwise it's just an expensive soaking device. Make sure your ultrasonic is working, because it takes both the detergent and the ultrasonic to get those soils off. pH is something that most of us kind of understand from a vague sort of way. So pH is just simply the scale from acid to alkaline. Do be aware that acidic products and alkaline products, if they're at either end of that scale, can be very corrosive. So there are many acids out there that are very good for descaling, but you don't want to use them daily because they will corrode your instruments. By the same token, if you're using household dishwasher detergent in your ultrasonic, that can be very alkaline. It's designed to cut fats off of dishes. It's not good for your instruments. So really watch it with those household cleaners on dental instruments. The other thing that I get a lot of questions on are, what about enzymatic detergent? Do I have to use enzymatic? And if so, what pH is it? You need to double check the particular product you have, look on the safety data sheet, and here's where on your safety data sheet, remember we saw the first 8 sections? Well, now you are also going to look at section 9 of your safety data sheet. That's where you'll see color, odor, and pH. So if you have a device that says use neutral detergent, look on the safety data sheet to find the pH. This is a quick review of instrument processing in chemicals. And basically, I want to emphasize something that actually is a question that came from a previous program. So someone was asking about how to remove cements and bonding agent off of instruments, and should you use acetone or other types of chemicals. This is a classic example of the misapplication of chemicals in cleaning instruments. And why does this happen? It happens because that very first step that's at the top, this is so important, I must repeat this to all of you. Wipe off cement and bonding agent at the point of use. During the treatment is the time to wipe off cements and bonding agent. If you do not get the cement and bonding agent off at the time of use, when it is still fresh and soft, it will be so difficult to get off later that any chemical that you use to try to get it off later will likely damage the instrument. That is the long and the short of dealing with cements and bonding agent. They must be removed at the time of treatment. And then that saves all sorts of problems later on. The other thing I like to mention that I think is not well understood in dentistry is the issue of the effect of delays in transport. Now, in most dental offices, it takes literally 1 minute to go from the treatment area to the instrument processing area. It's not like a hospital, but after it gets to the instrument processing area, it may sit there for an hour, 2 hours, till lunch, overnight. That's where the problem is. If you have instruments sitting around, even with tiny soil on them, and especially if it's cement or bonding agent, and it sits there for more than an hour, you have 2 problems. You have biofilm and you have corrosion. Those can all be prevented in 2 ways. Number 1, wipe bonding agents and cements off at the point of use during treatment. And number 2, use a pre-treatment spray if items are going to be sitting for more than a few minutes in the instrument processing area. This is very simple. You just simply have a spray there. You spray the items in their container and just cover it with either a wet towel or a lid. Get them stacked up until someone can get to them. And if you have a good pre-treatment product, that will protect your instruments until you can get to the rest of the cleaning process. The other thing I want to mention with chemicals is I don't care how great the chemical is. I don't care if it has great anti-corrosives in it. If it's something that you dilute with water or water plain by itself, should not be used as a soaking agent over 1 hour. If you do this over and over again, eventually water is very corrosive and you will see damage. Do not allow items to soak in water or detergent mixed with water for more than an hour at a time. This can happen in the ultrasonic or in a soak pan. So avoid that prolonged soaking. The other issue is water quality. We talked about water quality earlier, and rinsing. In dental offices, we don't typically use treated water for the final rinse. This can cause spotting. If you're seeing a lot of spotting on your instruments, there's 2 problems. 1, your water is probably too hard, and number 2, you're not drying everything completely before you package it and sterilize it. So think about those 2 things, water quality and drying your instruments to prevent spotting. So here's a few best practices for cleaning chemicals. The chemical label is the directions, it is the IFU. You need to combine the chemical label and the device IFU to understand how to, clean your instruments safely and correctly. I do not recommend using disinfectants as a holding chemical. It's not appropriate and it can cause problems. So don't use disinfectants as a general rule unless the IFU specifies it. Follow the directions on your chemicals for the dilution, the soak time, and the temperature. Enzymatic detergents in particular may require a certain temperature range to be effective. Change your cleaning solutions. Clean them frequently. You may even need to change them in the middle of the day, but certainly at least daily. Do not use the same cleaning solution more than one day. That is just not appropriate. Monitor the expiration storage of your chemical products. This slide is just simply illustrating that there can be directions on your equipment telling you that you have to be careful about using solvents or other aggressive chemicals on your chairs, your equipment, or your lights. So here's a takeaway that's worth the value of this entire program, and that's how to find chemical information for a device IFU. The number one thing you've got to do is get the directions for the device. So you can't, you may have dozens of devices. So pick the ones that are the most expensive and the most complex. Look at your electronics, look at your hand pieces. Look at those first and figure out what the directions are. And then find the chemicals that are recommended, and then look on your disinfectant and detergent labels to find the actual chemicals that are used. Remember, the chemicals may not be listed on the label. They may only be in the safety data sheet on section 3. You need to look everywhere. There is a new law that's going to be starting in 2021. You will start seeing some chemicals listed on most detergent labels starting in 2021. This has been fueled by California SB 258. If you have questions about that, call your chemical manufacturer and find out when those chemical ingredients may become available on the labels of the products you use. Household chemicals, in general, you don't need a safety data sheet if they're just used for their household use. But once you start using bleach or isopropyl alcohol for instrument processing, you must have the safety data sheet for it. And this finally is our chemical management checklist. It's not comprehensive. I mean, this is a checklist that can be used as a template. You can certainly add or subtract off of it, but it's a good starting point to help you in your office figure out, number one, get those chemicals inventoried, find out what you have, and then from there, start matching them up with correct safety data sheets that actually match the real chemical, not just the brand name, but the actual chemical. Certainly have a program for controlling your compressed gases, have your safety and emergency supplies gathered together. People need to be trained, but only after you've figured out your exposure control plan. This is, again, the responsibility of the employer, but you, the employee, you're the one that is most at risk. You may have to kind of push and urge and make sure that all of this is going on, even though it's your employer's responsibility to make sure it actually happens. So with that, I think we may have some questions. We're getting close to the end, so I want to find out what we may have for questions.
All right, Peggy, thank you so much for that important information. We do have a couple of questions for you. The first of which is, excuse me, are you saying to avoid the typical spray, wipe, spray method?
Oh, excellent question. Thank you so much. And that's why I kind of hurried there at the end to give you guys time to ask questions. So spray, wipe, spray is still valid. You can absolutely use liquid spray disinfectants. That it's not, you can use them safely. Let me put it that way. What you're trying to do is not to take a spray type of disinfectant and fog the room with it. You want to control the spray. The spray should be focused on the surface. The spray can be focused on a paper towel or other applicator and then applied to the surface. But just avoid using the disinfectant spray like a fogging device and using it all over, because frequently now we have open plan dental facilities, but there's not even walls between the units. And this is where you're basically killing each other with your disinfectant. So yes, you still want to spray, wipe, spray, control the spray. Just make sure it's not going everywhere, that it goes targeted to the surface you want to disinfect.
Okay, wonderful. If anyone else would like to submit a question, I know we do have another one, but for anyone else who is curious about any specific content that was given over the past hour, feel free to enter your question in the Q&A tool on the lower left-hand side of your page. Peggy, this next question says, would you share, I'm so curious to hear your answer to this too, would you share a story from your personal experience in the dental setting, sort of a moment in time that stood out to you where you realized the significant need for dental professionals to have more chemical exposure awareness?
Ooh, another great one. And yes, I have like way too many stories. So that's why I have to be careful not to get sidetracked with all the stories. So I guess that's really why I like to use the questions when people call and they're asking not even just about our chemicals, but just chemicals in general. And they'll tell me, well, you know, I've been using a disinfectant to soak our instruments, and they're looking kind of funny. And I'm asking, well, how are you soaking them? Well, we just want to make sure that the germs are dead before we start scrubbing them by hand. So we soak them in disinfectant for at least an hour or two. Well, and then, of course, it's the chemicals are corrosive on the particular instrument. But I have to say probably another chemical story that it's probably more funny than instructive is the very first week that I was here at Sertol, I thought, well, you know, this is going to be an interesting experience going from education to corporate. And the very first emergency call I ever received was somebody was using our disinfectant, and for some reason they had it in a beaker or a cup of some kind, and a patient grabbed it and thought it was mouthwash. Had it rinse their mouth. They spit it out right away, of course, because it tasted bad. But I thought, ooh, this is going to be an interesting job. So, chemicals are misused in so many ways because we depend sometimes on color or smell instead of knowing the brand and the correct application of the thing that, you know, we're trying to use. So, yeah, I guess I have to probably think a little bit harder about more specifics. I just know that there's a lot of times that people have, you know, tried to do the right thing. And I know in my history, before we knew better, we often used chemicals with bare hands. You know, that was what we did. We weren't even using gloves for intraoral procedures, let alone for chemicals. So it's a wonder if my skin hasn't melted off after all the years I've been in practice.
Well, I'm glad that hasn't happened to you.
Yeah,
Hopefully it's happened to nobody else. Oh, goodness. This next question that came through, working in the sterile processing field, I cringe when I go to the dentist because the staff is not educated on cleaning and sterilization protocols. How can employees be educated greater in these dental facilities?
Oh, that's another really awesome question, which I actually get a lot of that sort of comment from my sterile processing friends when I go do programs for sterile processing. And I tell people at those chapter meetings, I'll say, yeah, I'm a dental hygienist and now I specialize in chemicals. And then they'll tell me all kinds of stories about their dentist. So first of all, I want to share with all of you out there, whether you're in the medical world or the dental world, but especially for our medical sterile processing friends, your dentist can benefit from your expertise. You should never feel like you're causing a problem or whatever. I think you can ask them to look at their processing area, but just understand that a dental processing area is never going to be separated between decontam and the so-called clean side. It's not going to happen that way in dentistry. But on the other hand, you can give them a lot of great advice about how to maybe separate those areas a little bit more with clear plastic barriers or some other kind of strategies, and why it's important to not let the dirty spray get over on the clean side. Help them with their packaging. So don't feel empowered, because they need your help. And yes, it's a different environment. The instruments look different, but the goal is the same. the goal for all of us is patient safety. So I think that a good dentist and a good office will be receptive to your assistance and advice. And that's really, I would just encourage people to share that with their practice, their office. And if their dentist is a good dentist and it's a good office, they should be ready to hear you.
I love that. I love that. And that's sort of been a theme for today's question so far is, as we go to the dentist office as a patient, how can we share our expertise and how can we hold these facilities accountable to safe practices. So Peggy, thank you so much for once again sharing your incredible expertise with our audience today. We're grateful to have you. If anyone has further questions for Peggy, her contact information can be found on the speaker bio tool in the lower right-hand corner of your page. Email Peggy directly. I know that she's always willing to field questions about this area. So as a reminder, there will be a 15-minute break before the next session. We are so glad you're here. We hope you grab some water, grab a snack, assemble a tray, do whatever you need to do until you join us again. Peggy, thanks again. And to everyone tuned in, we'll see you in about 15 minutes.
Thank you.